Hi everybody, this is a new lecture entitled The Stop Sounds. I'm going just to remind you of a handout that we shared together where we draw the distinction between phonetics and phonology. You remember we said phonetics is descriptive, it is classificatory, but phonology goes beyond this job. It is functional, which means it does not look at sounds as just entities, inanimate entities, but it looks at them as moving things, moving living things that behave, that function. And this is the main distinction between the two branches, phonetics and phonology. Now, I hope that this distinction will become clear to you after the end of this lecture. But before I'm going on with the slides here, I need just to remind you that I have divided this lecture into two parts, part 1 and part 2, just to allow you to consult the different parts in a very easy way and to have easy access to them. So let us first of all deal with the first part here. Now, in our classification of consonants, we consider a stop sound as a posture. As I said, this is the job of phonetics. What is meant by a posture? It means simply we look at sounds as a kind of positioning of the articulators producing a structure of complete closure. Let me just explain it very briefly and quickly. Now, the sound k, from a phonetic point of view, what do we call it? How do we describe it? Among the labels we give it is that it is a Velar sound. K is a Velar sound. Why? Because we imagine there is a point of contact between the back of the tongue and the velum or the soft palate. So we put some kind of picture which is static, which shows to us how k is being articulated. Same thing for p, m, t, d and the others. Let me just once again take another sound as an example. T is an example in this case. What part of the tongue is raised toward which part of the roof of the mouth? Normally, since T is an alveolar sound, we think that it's the blade of the tongue which is raised towards the alveolar ridge. That's why it is called an alveolar sound. So what are we doing here? Well, trying just to take pictures where we position the articulators coming close to each other to show to us the place of articulation for a sound. Now, if we want to understand its function, the stop sound, in connected speech, we need not to look on a stop simply as a posture. It's not going to be enough for us to explain how sounds can be used in speech by native speakers. So we have to change our outlook, our point of view. Why? Because the phonetic view is a static view, as we have explained for k, t, and all the other sounds. Now, let's look at this example, which is concrete in this case. The sound b, which is a voiced stop. We tend to present this figure to show its articulation. We have got a complete contact between the lower lip and the upper lip. And this air is being held within the mouth, within the oral cavity, because we have got here the raising of the velum and the uvula. This is what we call the Velic Closure, because we have to prevent the air from going through the nasal cavity. So we have got two strictures. we obstruct the air at the level of the Velic closure and the articulatory structure here by means of the two lips. So the air is being held for some time within the oral cavity. So it's a static view of representing the articulation of a certain sound. This is what happens within the framework of phonetics. Now, a stop involves not only a posture, this posture here, this way of representing the pronunciation of B, but it involves a movement to that posture and a movement away from it. So what do we notice here? We have three different things. We have the posture, the central element. But before the posture, there is going to be a movement to it. And after the posture ends or is finished, normally we should move away from it. So three things here. Now, the manner in which this posture is taken up, this is the movement towards it, and subsequently relinquished, this is the movement away from it. These are additional factors which have to be taken into account if we want to understand how sounds can behave in connected speech. We have to take the three, if you like, phases, the three stages into account. And this is going to be clear through the figure we're going to see later on. Now, therefore, in order to discuss and determine the function of a stop in connected speech, we must distinguish three phases in its production. Okay, we have got a movement towards the posture, and we have got the posture itself, and we have got a movement away from it. This is what we are going to explain through these phases. We have got phase 1, the shutting phase, leading to phase 2, the closure phase, followed by phase 3, the opening phase. Okay, now it's going to be clearly felt when we produce Aba, the sequence of sounds. Aba. Notice, when we want to produce B, especially after the production of the vowel A, here the first one, we notice that the lips can be observed to come together. There is a certain time that the two lips can take while coming towards each other. And after that, this is phase 1, there comes phase 2, when the two lips stay together for a moment. This is phase 2. Afterwards, the air which is being held within our mouth while the two lips are staying together for a moment, it should be released. And how can we release the air? It's we have to open the passage for it. That is, the two lips should part. Okay, so the lips can be observed to come together, phase 1, to stay together for a moment, phase 2, and then to part, phase 3. So here we are going to have a look at this figure that shows to us clearly the three phases in the life of stops. Notice I say the life of stops. It's as if we are talking about stops as human beings. They are born, they live for some time, and then they die. They have to finish, they have to end. So look, when you want to produce B in Aba, you notice that the two lips are coming together. There is a certain time that they take to come together. This is shown by the converging lines. Here they come together and they remain close to each other for some time. This is phase 2 here. After having that complete contact between them, we need to release the air at the end. And look here, the separating lines. It means that the air is going to be released through the mouth. Abba, abba, abba here. So please remember the 3 phases. When the 2 articulators are coming close, when there is a complete contact between them, this is phase 2, the closing phase, the closure, if you like. This is the shutting phase, the closure, and this is the releasing phase or the opening phase. Now, because of the Velic closure and the articulatory stricture of complete closure, there is a complete interruption of the air stream. Remember what we said in here. This is the articulatory stricture and this is the Velic closure. The air is being held here. There is a complete obstruction of the air. So this is what we said here. Because of the Velic closure and the articulatory stricture of complete closure, there is a complete interruption of the air stream. Now, each phase is very brief in duration. Still, there is enough time for the air pressure behind the closure to be altered, to be changed by the action of the air stream mechanism. This is what we are going to explain later on. Normally, when the articulators separate, the compressed air explodes outwards. For example, when you want to say b, so you need after the end, okay, at the end of the pronunciation of b, you need to release the air. This air which is released, it takes the shape of plosion. That's why stops which are produced in this way, they are called plosives. This is another label for stops. Okay? Now, phase 2 is the least conspicuous auditorily of the 3. This is the phase that we don't hear. Look, auditory, it means we are talking about sound from the auditory point of view, how we perceive them, how we hear them. So this is the phase 2 is the one that we don't even recognize because we don't hear it. During phase 2, there is either a low murmur if the stop is voiced. If you produce a voice stop, you hear something like a murmur. So it's not perceptible. Okay? Or we can have complete silence if it is not voiced. Now, phase 1 is not conspicuous either. We don't even recognize it, we don't hear it. And if the stop is initial, it is imperceptible. What do you mean by this? If the stop sound is used in the initial position of words or phrases or expressions in general, we don't even recognize them, we don't hear them, we don't perceive them. Now, among these phases, it's only phase 3 which has got more noise because of the sudden explosive release of air pressure built during phase 2. Notice that we said after that is at the end of the production of the stop, we should release the air, which takes the form of plosion. And this is what we hear most. So we can say phase 3 is the most conspicuous, among the phases in the life of a stop. Sometimes this release of air pressure does not take place, and we are going to explain it through concrete examples. Through this, we are going to show the behavior, the function of sounds, how sounds influence each other. Okay, so remember, the release of air. When I talk about the release of air, I am having in mind phase 3 in the life of stops. So this release of air pressure does not take place. Phase 1 and 3 may be modified in various ways, or may be absent altogether. And let's have now concrete examples to show the function of sounds and how this new way of approaching stops is going to be of great help to us to understand the interference between sounds in different phonetic environments. So phases 1 and 3 may be modified in various ways or may be absent altogether. Let's talk about the first case, stops and Velic action. Remember what we said about Velic action. We can talk about Velic opening and Velic closure. Number 1. The opening movement, which constitutes phase 3 of a stop, may be transferred from the articulators to the velum. Look at this example. Submarine. Submarine. Now the stop in this case is B in blue. How do we normally produce or articulate B in this context when it is followed by a bilabial nasal sound? Do we say sub B? Do we release the air for B and then we go on to the production of M? Do we say sub B marine? Look, the articulators remain in position at the conclusion of phase 2 for the production of B, but the velum is lowered so that the Velic closure is removed. So notice here, we don't release the air for B. The air is still kept held in our mouth. The air which is kept in the mouth, it goes through the nose. Instead of releasing it through the mouth to say sub B, we keep it and we allow it to go through the nose. Why? Because M is also a bilabial sound which is nasal. So here, if you like, phase 3, which is this one here, does not take place in the production of B in submarine. We don't say sub B, we don't release the air in phase 3. So phase 3 here is absent. Okay? So submarine. Look, the articulators remain in position. What articulators are we talking about? It's the lower lip and the upper lip that produce B. The articulators remain in position at the conclusion of phase 2. But the velum is lowered. Why do we need to lower the velum? In order to allow the air to go through the nose, so that the Velic closure is removed. So we are going to have Velic opening, because we have got a nasal sound following B. What is the consequence of this? The compressed air for B escapes through the nasal cavity instead of through the oral cavity. The plosion is then nasal plosion instead of oral plosion. Okay, so in fact here we are talking about a nasal stop, or a nasal, a stop which has become nasally released. Sorry, it becomes a stop nasally released. So we call it a nasal release. A nasal release here. Look, contrast submarine with abnormal. Is B in abnormal, is it pronounced, articulated in the same way as B in submarine? Which means phase 3 for B in abnormal, does it happen, does it take place for B or not? Or is it absent? Here normally we say abnormal. Abnormal. Why? Because N is not a bilabial sound. Okay, so if we want to obtain a nasal release, we should have a homorganic nasal following it. Here we say abnormal. We release the air for B and then we go to the production of N. But in here we say submarine. Submarine. The air which is kept for B still, I mean, it is still held here in the mouth, but it goes through what? Through the nose, because of the Velic opening here. And in here, there is no Velic opening in B, in abnormal here. Now, this helps us understand the inter-influence of sounds and come up with the right rule. In a way, we're going to have another section where we're going to present different phonological rules, and this is going to be one among them. Now, nasal plosion only takes place when a stop is immediately followed by a homorganic nasal. This is what we have just explained here. Nasal plosion is the transference of phase 3 to Velic action from articulatory action. This is what we have explained here. Now, this is the end of part 1, explaining to you the life of stops, trying to show to you the difference between phonetics and phonology, and through this we will try to come up with the right rules that will translate for us how sounds interact, how sounds influence each other in connected speech. Thank you, and let's meet in the other occasion where we're going to have the second part of this course.